to rock and roll.
Okay.
35.
Welcome to another live edition of HealthLine on PBS39. I'm your host this evening, Mark Evans, and of course we're talking about a topic that we don't normally talk about around the water cooler or perhaps at the dinner table. We're talking about women's physical therapy, which offers much more than common rehabilitation procedures, but also the relief of pelvic pain and helping patients gain control over incontinence issues. And we're going to have a candid discussion on those, and we invite your calls at 969-2720 or long distance toll free 1-866-969-2720. Our special guest expert, we had you on earlier in the year, and I guess back by popular demand because we had so many questions to follow up after that show. But it's Margaret Bryden. She is a woman's physical therapist and women's health director at Indiana Physical Therapy, returning. And it's nice to have you back.
It's nice to be back.
As always, we do want to open up our phone lines for the questions, and as they come up, please just give us a call and we'll go ahead and interrupt and get those calls on the air. Margaret, let's go ahead and start by letting everyone know exactly what women's physical therapy is. Now, physical therapy, of course, there's for men and then women. What are the differences?
Women's physical therapy specializes in the special needs of women as they go through the lifespan, from childbirth on through menopause and the aging years. And because we give birth, we have special needs, especially related to the pelvic floor, which is my particular expertise, and what happens to the body as we give birth to multiple children and then go through the different vigors of aging and hormones.
Okay, and we're going to talk more about that a little later on, but I also want to pave the platform here. What are some of the benefits of a women's only clinic that you oversee?
A women's only clinic is a very unique place, and it's a chance to have a location designed only for women, with literature that's unique to women, women-only physical therapists, private treatment areas, very allows for intimate discussions about possibly embarrassing, possibly very sensitive issues in a place where there are only other women therapists and other women patients.
Have they found through trying this out and separating the two, is this more successful?
Absolutely. You can gain a lot more information. You get a lot more trust from the client. And I think that overall the area gives a lot more of a sensitive, allows for more sensitive discussions.
Okay, and I can see that. Now, if a potential patient wanted to receive some services or get consulted by a physical therapist, can they just walk in or call and make an appointment? How does that work?
In the state of Indiana, you need a physician's referral for physical therapy.
Why is that?
That's just how it is. Direct access is allowed in some states, but Indiana is not one of them at this time. But it's quite easy. Most of the time these women are seeing their physicians for these particular problems. They just need to kind of stop the barrier of being embarrassed about talking about leaking urine, or not be embarrassed about telling their doctor that they're experiencing pain during intercourse, and allowing their doctor to listen to them and provide physical therapy as an option for them.
Okay, and as I mentioned at the beginning of the program, and as you touched on just a little bit, there is physical therapy available to help relieve pelvic pain. So let's go ahead and identify that for those who don't know, and we'll talk about what you can do for it.
Pelvic pain could be from many, many causes. It could be during pregnancy, that sort of low back pain that happens during pregnancy. It could be deep pain inside the pelvis that they experience during intercourse, or perhaps when they're walking, or when they're moving. It could be after an episiotomy, after they've given birth. They can't sit on hard surfaces, or they can't wear tight clothes in that area. So those are some various, sometimes after hip replacement, they may have a deep pelvic pain as well.
Okay, let's get back to pelvic pain in just a moment. We do want to go to line 1, though, because Carol's been waiting. Carol, go ahead with your question for Margaret.
Margaret, I've had urinary incontinence in the past, and I did have the normal bladder tuck about 13 years ago, and that lasted for a while. Now I'm having a different type of problem. I'm 68 years old. It's not with the coughing, sneezing, jumping, that type of thing, but now it's just the immediate urge, and it is immediate, and it's not a trickle.
Absolutely.
And this is fairly common, isn't it?
Absolutely, yes. Basically, Carol, what you're experiencing is called urge incontinence. The surgery that you had did help the problem that you were having before. Now you're having this intense urge. There's several things that you can do. You can certainly, one of the areas that I train people is to work their pelvic floor quickly and strongly. So one of the things I get people to do for urge is to learn to contract their pelvic floor quickly and strongly when you get that urge. What that does is, I'll show you on this model here, basically the bladder kind of sits on the base of that base of this area here, and your pelvic floor and your bladder work together. When your bladder contracts, when you have an urge, your pelvic floor relaxes, and then you intensely have to go. What you can do with those exercises is relax your bladder, and that will, by doing that, you contract your pelvic floor, and that will relax your bladder, and then you'll be able to stop that urge. It's a very simple technique, and I could easily teach you that, or another women's health physical therapist could teach you that very easily.
How long would a session for that be, and how often would she have to go back?
Typically, someone like Carol with this problem, I would see once a week for maybe 3 or 4 visits, and we should be able to get her under control. If she's having a real problem getting those, we may use a device called biofeedback, which would help her train those muscles in that way. But it's just the fact that even though she's had the surgery, her muscles need to be trained.
Okay. Thanks for your call, Carol. And you mentioned urge incontinence, and of course there are other types of incontinence. We have stress incontinence, mixed incontinence, and functional incontinence. Can you go over those really quick?
Stress incontinence, just like Carol was describing, is the kind of incontinence you get when you laugh, sneeze, cough, jump, exercise. The urge incontinence is that intense urge, you have to go now and you can't wait. Functional incontinence is typically the kind of incontinence which is related to maybe weakness, overall weakness or deconditioning, perhaps like a woman who wants to go to the bathroom but they have knee problems or hip problems, or they have trouble getting out of a chair. So part of that incontinence is because of limited mobility.
Okay. And did you talk about mixed incontinence?
Mixed incontinence is a combination of both stress and urge, which is the most common.
All right. Now, what is the main cause for causing incontinence?
There's just varied reasons for incontinence. A common reason for incontinence, and one thing that Carol kind of described, is pelvic organ prolapse. With a number of children, giving birth to a number of children, a lot of times your bladder can fall or your rectum can fall, and what that does is it makes it a lot more difficult to contract the pelvic floor. So one of the things that we do with physical therapy is train the muscles so that we lift basically those organs, and if we can do it early enough, you can sometimes prevent or at least put off that type of surgery.
I see. So now, before any surgery is even considered, would a physician perhaps send you over to a physical therapist to see if you can work these things out first?
Many excellent gynecologists send for physical therapy first prior to considering doing the surgery. It also makes the surgery more successful because at the end of the day, even if they need the surgery, just like Carol found, she still needs to work her muscles.
What about prescriptions and drugs? Would that be something that you would tackle first before you would go to a physical therapist to see if anything would be relieved through the drugs or the prescriptions, or should they see a physical therapist first? What protocol would that
Obviously,
entail?
I'm biased as a physical therapist,
right.
so I believe that you can work the muscles, but a lot of times they will do in conjunction with some of the bladder drugs. That urge suppression technique that I was describing does a lot of the work that, let's say, a bladder suppressant type of drug would do, which is basically relax the bladder muscle. And in the same way, that's training the bladder to relax through using the muscles in the way that you're innervated.
All right. For those of you who are just tuning in to PBS39 HealthLine tonight, we're talking about women's issues, women's physical therapy. It's more than working the limbs. It goes a lot deeper than that, and we're talking about pelvic pain and urinary incontinence. Now, let's go back to pelvic pain. We were talking about that earlier. We do have a call on hold. We'll get to this question first, though. I want to ask you, what are the main causes for pelvic pain? Why do women suffer that?
Again, people can get pelvic pain through giving birth. They may get it through stress. A lot of times when people have stress, they can have a migraine or a headache, but they can also get pain in the pelvis. And the muscles deep in the pelvic floor can tighten up and create trigger points, and that can create pain when they're walking or moving or during intercourse.
Okay, okay, it's a little clearer for us to understand. Let's go to line one. I think we're going to go back to this topic of incontinence, and I think we have Anita standing by. Go ahead, Anita.
Yes, I have had 8 children. My first one weighed 10.6, and I had them within 2 hours.
Wow.
And it was vaginal. I mean, but I never had any problems until I reached probably 50. And now, I mean, I'm 76. I'll be 77 in November. And I have the problem of I get up in the morning, I urinate. I go in my kitchen to get my breakfast, and maybe 2 minutes later, I have to go back. I do not empty my bladder.
Right.
All the way. Although it feels like it is at the time I'm there. And I do this all day long. And I do have to wear a diaper and a pad because I leak a lot. I just can't get there fast enough sometimes. Now I can hold it sometimes. Like if I'm traveling, if I have to go, I can hold it until I get to the bathroom. And then, I mean, there's urgency there. If the bathroom's there, I mean, there's urgency. I'm leaking, right away.
Yep.
So this would be in the classification of urgent incontinency.
I guess.
Okay.
I guess it would be.
All right, Anita, thank you. We'll get an answer on that.
Yes, Anita, one of the things that you're definitely having trouble with is emptying your bladder. And this is most likely having 8 children, of course, not seeing you, but I would suspect that you have some sort of bladder prolapse. If you imagine a pitcher of water, but the pitcher is shaped kind of like an odd-shaped pitcher, and you try to pour it out, and there's always a little of liquid at the bottom. That's kind of what happens when you're prolapsed. It doesn't sit up nice like a new bladder. Basically, it's kind of tipped over. And when you try to empty, you're emptying some into the urethra, but you're literally emptying lots into this pocket. So then the minute you get up and you move around, you dump some more into the urethra. So you continue to have to go. Obviously, you did not drink 2 cups of fluid, from 10 minutes time. So that's why she continues to have these problems. So one of the things that I teach people is an emptying technique, and kind of candidly call it a toilet dance. And basically after going to the bathroom, instead of pushing, which you're just going to basically make the pocket bigger, what you want to do is you want to maybe lean forward, lean back, maybe go to the side, the other side, stand up, sit down, do a little dance until you get all of the urine out of that bladder. At the end of that, you do a pelvic floor contraction or a Kegel to basically shut the door or close everything off, and then you go off on your business. So by making sure you empty your bladder, you're going to make sure that that bladder is empty, and you're not going to get that every 10-minute business.
What kind of physical therapy could help Anita?
Women's health physical therapy will absolutely help because she would get education, she would learn how to use her pelvic floor, and she would definitely get a little bit more success than she's been dealing with.
Does age make a difference when it comes to the physical therapy?
Absolutely not.
Truly?
I've treated people from 18 to probably 90.
Wow. Well, thank you for your call, Anita, and we're still inviting calls until the end of the show at 969-2720, talking about women's issues tonight. Let's get back to the pelvic pain. Is this more common than we men realize? I mean, do women really suffer from this?
A lot of women, and I'm surprised every day at how many. I do talks all over the place, and I'll talk to new moms, or I'll talk to different women's groups, and inevitably I'll get 5 or 6 people coming at the end of the talk saying, oh my gosh, I didn't know I had this problem. And I ask people questions, and I get them to fill out a questionnaire, and the questions are a little bit sensitive. I'll ask, specifically when they have pain, if they have pain during penetration, if they feel like they have pain during intercourse, if it's related to certain positions, things like that. And by asking all those questions, we can really determine what is going on even before we actually do the pelvic exam.
And this has to affect the woman's the psychological factor as well as perhaps intimacy.
Absolutely. I've had so many patients who are so grateful at the end of their treatment. They may be dealing with this for some time, either having intercourse with pain and not enjoying it, or trying to avoid it because it's painful. This creates a gap in the communication between the husband and wife, and can create further distancing between them. And I've had it to the point, and a lot of times I will have the husband in the room during the particular exam. Well, we don't have men in our gym, but we do have them in our treatment room if the woman would like that. And a lot of times they're very shocked and surprised at the things that we talk about and where the pain that the woman is having and where her trigger points are.
Now, you mentioned that you have young and older patients, and some of the younger patients. What problems are you seeing there as regarding pelvic pain and or incontinence?
With the younger women, sometimes they have incontinence if they've started having children early and they haven't gained control of their pelvic floor. Sometimes it's related to when they have had many children in a row. Other times it could be related to weight a little bit. Every 5 to 7 pounds that you gain, you have a higher chance of getting incontinence. With the pelvic pain with the younger women, a lot of times I have young women who cannot consummate their relationship, and those women have difficulty relaxing their pelvic floor. So we need to work on what we call down training, which is teaching them to relax their pelvic floor so that they're able to allow for intercourse.
All right, now let's just go back, and I know that you're the director of the women's side of the Indiana Physical Therapy. What would one expect? Now we'll use yours as a model, your clinic as a model. When they would come in for a consultation all the way through physical therapy, what are the steps one could expect to take?
They would basically come into a place where they felt comfortable. It looks like a living room. They're able to read literature relating to many problems that women have. They would have a nice sort of atmosphere. They would be brought into a private treatment room where they're filling out a questionnaire. Then they're interviewed by myself or another physical therapist for an hour, where we go through very extensive history. We go through a full physical therapy external exam and then an internal pelvic exam. And then when we start doing treatment, some of the treatment is done in those private rooms for the internal part, and then some of it's done in our private women's only gym, where they're given specific exercises that are related to their problem, especially like abdominal exercises or flexibility exercises, anything that could be specifically related to it, determined by that initial assessment.
And all this time, are you working alongside their primary care physician?
Absolutely. All the information is sent to their physician on a regular basis.
Okay, very good. We have Sheila and we have Virgie on lines 1 and 2 respectively. We'll go to Sheila first. Sheila, your question, please.
Yes, I've been to physical therapy for my back, and I have problems with my pelvic, not staying in line. I have a hard time keeping in line to put it back. And the physical therapy helped my back. I still have a lot of problems with that, with my pelvic, and I have a lot of pain there. Is there any way I can keep it in line? Any suggestions I can do?
I'm sure your physical therapist, Sheila, gave you some abdominal exercises. It's very important when your pelvic alignment is going out all the time that you stabilize it with muscles. So the exercises that they would have given you would be some exercises probably laying on your back and moving your legs, or maybe doing some standing exercises or pulling your belly button in. Those exercises are going to help keep you in line.
Anything else, Sheila?
That's a lot. Thanks a lot.
Well, you bet. Let's go to line 2 with Virgie, who is having some problems with the liver and stomach. Go ahead.
My sister died from calcification of the liver, and my stomach is distended and sort of puffy, you know. And I wondered if, now she had terrible pain. I have no pain in it. And I just wondered if there's awful pain connected with it, if that's when the liver is affected, or if there's no pain. I can punch my stomach all around. It's just awfully puffy.
Yeah, a lot of times stomach problems, that you can have pain that can be helped by physical therapy. This particular problem, I would definitely suggest, Virgie, that you consult with your doctor just to make sure, because you have that family history. But a lot of women do have some stomach pain, perhaps if they've had endometriosis or they've had a lot of abdominal surgeries like appendix surgery or gallbladder surgery, and even laparoscopic surgery or hysterectomies, and they can have scar tissue that is formed, and when they reach or lean or turn, they'll have pain, and that can be related into the bottom of the pelvis. And so a lot of times we can do a lot of massage work, and that will help that stomach pain.
All right. We still have some time to take some more calls at 969-2720. Very interesting topic tonight. 1-866-969-2720 if you're long distance. We're talking about pelvic pain and also urinary incontinence, along with other women's issues when it comes to physical therapy. And physical therapy is something that can take care of a lot of these problems, as we're talking with Margaret Bryden of Indiana Physical Therapy, who is the director of the women's side. Well, great. It's nice to have you here once again. And are there anything else that we might be missing at this time that we need to make sure we get a message out to the people who are watching regarding these subjects?
Well, a lot of women are concerned when their doctor says they have pelvic pain or they have incontinence, but particularly pelvic pain. You know, the doctor will say, well, I think you should go to physical therapy, and they kind of seem shocked, like, what will they do? What will a physical therapist do for me? And I think they're unrelated, or they don't realize that there are women's physical therapists out there who can actually do the pelvic work and actually examine their pelvic floor. Has
this been something new, a new advancement, or is this something that's been around that just people haven't been talking about?
It's fairly new in the sense that there's more and more women's health therapists getting trained to do this work. Right now there's about 400 in the U.S. going through a certification process given by the American Physical Therapy Association for certification in pelvic physical therapy. And probably about maybe 50 total in the whole U.S. that have the certification. All
right, well, let's go over and comb through, because we have about 5 minutes left. I want to comb through how you can have pelvic pain and then the symptoms, other than the pain, if we could, because some people might identify with that and say, you know, I ought to talk to my doctor about this.
Yes. Basically, it's not normal to be leaking urine when you cough, sneeze, laugh. It's not normal to wake up in the middle of the night 3 times and go to the bathroom. It's not normal to have pain during intercourse. And it's not normal as you get older to be all humped over. So those are the things that you really, they really need to understand. If they're experiencing pain during intercourse, whether they've always experienced it or if it's just something that's new, they needn't think that it's something that's just in their head, or, oh, you know, it's related to, you know, my menstrual cycle or anything like that. They need to pay attention to that and not be embarrassed to go to their doctor with this concern.
And what about incontinency, other than the obvious symptoms? Is there anything else that might be creeping up on an individual that they might say, you know, before it gets worse, I need to go see the doctor about this? Any pain or any signals at all?
Typically, they'll start with something like they'll start going to the bathroom in the middle of the night. That's usually the first one. Then the second thing is usually if they have a bad cold, they'll leak a little bit, or if they run, they'll leak a little bit. And those would be the first signs that they're having some incontinence issues.
All right. We're going to go ahead and go to line 2 now with Rosemary. Rosemary, go ahead with your question.
Oh, I don't have a question. Margaret, I just wanted to tell you that physical therapy is the way to go. I have had it for numerous injuries. I'm a newly retired school teacher, fell up the stairs at school. I know Trent Smith quite well at the New Haven office. I know he's one of the co-owners. Ben was my therapist. I just told the person from Channel 39, physical therapy, ladies, out there in TV land is the way to go. Don't be afraid of it. It is a godsend. It does provide a lot of relief.
It does work.
Absolutely.
All right, well, thank you so much. Let's go to, actually, we want to go to line 1, but Sue doesn't want to be on the air. But can you read that? I don't even know how to pronounce that word. Can you see that?
Yes.
Okay, what is that? And she's asking about Kegels?
She had an episiotomy, and she does her Kegels, but she still has incontinence. So she had an episiotomy, so she was cut when she had her baby and sewn up. And she basically is doing her pelvic floor exercises, or she thinks she is, but she still has incontinence. Studies have shown that 60% of women who are told how to do Kegels do not do them correctly. So Sue is not alone. And so I would definitely recommend, Sue, that you come in and see a women's health physical therapist, because you probably are not doing them correctly. So many women that I ask to do a Kegel, when I first do that, push out or do it incorrectly, and it's absolutely, you can be trained to do them correctly.
All right, very good. We have about a minute and a half left. If you have any last minute questions, call those in right away. I want to ask though, when it comes to, of course, women are dealing with these problems. How important is support from the spouses, the significant others and family members to help them through these situations?
Well, with pelvic pain, it's essential because the better communication that can happen between a husband and a wife, the easier it is for this woman to deal with. A lot of times when we are working with the pelvic pain, I will encourage, and this woman may not have been able to have intercourse for some time because she's afraid of pain. So there is an encouragement of kind of gradually getting back into it. I suggest different positions, perhaps you know, shortening the time and situations like that. So the more cooperation I can have from that spouse, the better it is for the woman.
Okay, very good. Any last comments before we wrap up?
No, I just think that this is a wonderful field, and I do believe that so many women can be helped by it, and I encourage women not to be scared to talk to their doctors about these problems.
Absolutely, and they need to make those phone calls and maybe even do some research. I did find some interesting things on webmd.com if anybody would like to check that out. And we thank you so much for your calls tonight and this interesting topic, and Margaret, for you being here. Organ Procurement is our next live program coming up next Thursday with Joan Smith and Leah Smith of IOPO, the Indiana Organ Procurement Organization. There we go. I have it all there. Well, thank you again, Margaret Bryden from the Indiana Physical Therapy, who is the director of the women's section, the director at the Indiana, let's see, that would be the women's health director, to be exact. And thank you for bringing your model as well. That actually did help very much. I'm Mark Evans. Thanks so much for your calls, and thanks for watching PBS 39's HealthLine. We'll see you next time. Good night.